morning, everyone. Today we have on board with us Dr. Sarmila Sinha, a psychiatrist based in the UK with a special interest in ADHD. She is a trainer for stress management at the British Society for Lifestyle Medicine. She is the founder of CPD accredited course providers Living Life Stress Free and Mental Health Online Training. Good morning, ma'am. Would you like to give a brief introduction about the topic?
Thank you for inviting me. It's a pleasure to be with all of you. So, as you mentioned, yes, I work as a psychiatrist in the UK, and my special interest is ADHD. So, yeah, I'm here to talk to you about it. You can fire away questions.
Okay, let's start with the questions. So, ma'am, my first question is very relevant to the topic, and it is basically the entire topic of understanding ADHD, with which we have to begin. What is ADHD?
All right. So ADHD, also known as attention deficit hyperactivity disorder, it is a neurodevelopmental disorder. Originally, it was thought that it is a childhood disorder. It begins in childhood, and by the time a person becomes an adult, most of the symptoms go away. However, according to DSM-5, as of 2013, it is no longer classified as a childhood disorder, but it is considered as a chronic lifelong disorder. And although this condition does begin from childhood and most noticeable in adolescence and childhood, but more than 50% of the symptoms can persist throughout adulthood.
All right. So, what are the easily recognizable signs of ADHD? Like, how does it usually manifest itself?
So, as I mentioned, that it is a neurodevelopmental condition. So, most likely it does affect how the brain works. So, whereas normally people can organize themselves, they can plan, they can pay attention, just the basic things. So that is impaired. And in fact, there are lots of studies, lots of structural imaging studies. It shows that the brains of children with ADHD are significantly smaller than the unaffected controls. In fact, things like the prefrontal cortex, basal ganglia, cerebellum, all of them are affected. So there is a frontal executive impairment. So like the ability to organize, plan, prioritize, execution, these are all impaired. There is lack of perseverance, attention shifting, and they can't control inhibit. So there is a lot of importance on instant reward cues. So they cannot control the inhibit. So symptoms of like binge eating, even things like that, because the food is there, so they have to eat. So things like this, so they cannot control the inhibit impulses. So it usually manifests, we normally divide it into three main types, like the hyperactive type, inattentive type, and the combined type. So the hyperactive type is more prominent among boys, and it usually manifests like lack of control of impulses and the behavior. And it's usually commonly misunderstood as bad behavior. So there's a lot of fidgeting, there's a lot of running around, there's a lot of shouting, loud behavior. And as the child goes through adolescence, the hyperactive behavior becomes more generalized restlessness and irritability. It manifests like that. And the next one is the inattentive symptoms. The inattentive symptoms, it usually manifests with difficulties such as staying focused and attending to daily mundane tasks without being distracted. Perhaps moving from one activity to another, or they become bored very quickly. And in school, they usually manifest in school the teachers may say, oh, the child daydreams, the child cannot focus, there is a lack of attention, underachievement in class. And this can be sometimes dismissed as laziness, or even, sometimes they can be thought that they are quite creative, or they're daydreaming and they can be gone with the fairies and things like that. Now, the other bit is the combined type. The combined type, actually, there is a combination of both inattentive symptoms as well as the hyperactive symptoms, if that makes sense. Yeah.
Yes, thank you. So, is there any genetic?
Came across?
Yeah, as I mentioned that this condition manifests in childhood. There is a lot of like neurobiological component, and the genetic component is definitely there. It is ADHD is widely believed to be a heritable condition. It's a genetic condition. So we do see like family members. We normally ask in our clinic, does anybody within your family have ADHD or among your close family members? And so usually there is a family history. And there are lots of genes that are affected. The common ones I can think about is the dopamine D4 receptor gene and the dopamine D5 receptor gene. So these are two genes that most comes in my mind. Now, there is also a condition called conduct disorder in childhood. Now, conduct disorder and ADHD, they're combined, and there is a particular gene which is involved, which is the COMT gene, variant gene. So yeah, it is definitely a genetic condition.
Ma'am, so there is this word around that ADHD goes underdiagnosed in girls. So how does it manifest in girls, and why does it go underdiagnosed?
So I think there has been a lot of misunderstanding that ADHD is more commonly present in the boys. The reason is because people misunderstand ADHD to be just a hyperactive disorder. They don't consider the inattentive aspect of it. And this is why it kind of gets missed in girls, because the hyperactive component is more prominent in the boys. Now, girls, they do definitely have a bit more of the inattentive symptoms. It is widely believed. However, there was a large European study called the ADOR study, which took place, and it took into factor a couple of European countries, and they looked at the core ADHD symptoms between the two genders. And in fact, they found that there's not much difference between boys and girls. I think from my personal experience, what happens is, although the girls do have the inattentive symptoms, the parents or the teachers, they don't take it forward. They don't get them assessed. It is not that they are, the symptoms are less important or less significant in girls. Maybe it's the same in boys and girls. It's just that girls go, they get less referrals for the diagnosis, and the boys get more referrals. However, the hyperactive component is slightly more among the boys.
Okay, so is there a difference in the incidence ratio amongst boys and girls, and is it true to the picture?
So with the incidence ratio, we have to go with what is available, the data, whatever the research is showing, isn't it? So the same European study, the ADOR study, it actually looked at 10 European countries for children aged between 6 to 18 years. And now there's a lot of disparity between different countries reporting the ratio between the girls and the boys having ADHD. And this ratio actually ranged from 1:3. So basically, if there's one girl and 3 boys, so there's a 1:3 ratio, and it ranged from 1:3 to 1:16 among females and males. So there is definitely a big gender gap in terms of incidence, but this could be due to the reporting. Could be due to the data collection, because more boys are getting referred. However, there was another study, which was which is a worldwide analysis. They looked at 11 studies of adults with ADHD, and they found that the gender gap decreased among the adults with ADHD. But even though the gender gap did decrease, but still there was a ratio of 1 to 1.6. But it's much better than children, because in children the gender gap is much wider. Among the adults, it is almost ratio 1:1 or 1:1.6.
Okay. So what are the differential diagnoses of ADHD, or what could it be misdiagnosed as?
So the problem with ADHD is that there are some symptoms of ADHD which can overlap with other psychiatric disorders. Things like irritability, low mood, anxiety symptoms. And these are mostly manifested as part of the inattentive picture. Because the child is unable to focus in class, they're unable to follow instructions, and they are afraid that the teacher is going to punish them, they're going to hold them into account for not doing the homework, for not paying attention. So naturally, the anxiety levels are more. So because of this, usually the common mental disorders that they usually misdiagnosed with when they first present is Sorry about that. So the common mental disorders they present, it could be anxiety disorders, depression, even bipolar disorder, because there is a mood fluctuation. And sometimes there is also the other diagnosis of personality disorder, like borderline personality disorder. The reason borderline personality disorder is considered is because of the impulsivity. They are more impulsive. And one of the key features in borderline is that they do have mood swings and they're quite impulsive. So these are some of the mental disorders. And there is also, in children, there is conduct disorders. There is another condition which probably is not picked up and is also commonly present along with ADHD or even outside ADHD, is the autism. So the autistic spectrum disorder, children can have some symptoms which are overlapped with ADHD. Sometimes they get misdiagnosed. So an autistic child may be misdiagnosed with ADHD, or an ADHD child could be misdiagnosed as autistic. So there is some misdiagnosis, there is a possibility. And the reason for the misdiagnosis is simply because there are the overlapping symptoms. So if you want, I can tell you a little bit more on this.
Yes, sure.
So the impulse control problem. So when you're looking at ADHD and you look at the impulse control problem, so the diagnosis that commonly comes into mind are the personality disorders, like borderline personality disorder, antisocial personality disorder. And antisocial is more common among the boys because they are disruptive in class, they are oppositional towards the teachers. They have this, there's another condition called oppositional defiant disorder. So they challenge authority, and they most likely get into trouble for fighting, and they get into trouble with the police as well. And conduct disorder. The next is the anxiety disorders. Anxiety disorders like generalized anxiety disorder, social phobia, obsessive compulsive disorder, panic disorder. All of these are the anxiety disorders which there is overlap of symptoms, plus they get misdiagnosed. And with OCD particularly, if a child has some autistic traits, and sometimes there is overlap of autistic traits and ADHD, and if they have them, then OCD can become an overlapping diagnosis. There could be sleep disorders. People with ADHD, they struggle to fall asleep. The brain can't switch off. So at night, they mostly say, I struggle to fall asleep. Or sometimes they are so fidgety, even in bed, that they can't fall asleep. Then the next is the substance misuse disorder. Substance misuse disorders, like addiction problems, obviously. So what they do, and this happens mostly among adults, is they try to self-manage the problem by taking cannabis, by drinking excess alcohol. They try to numb the brain. And so they do have this problem, substance misuse. And the next is the mood disorders. Mood disorders like depression, bipolar illness. So all of these can factor in.
Okay. So is there any treatment available for ADHD, and how can it be managed?
So with the terms of treatment, we do have like pharmacological treatment, psychological treatment, and we also do occupational health assessments. So in terms of pharmacological treatment, there is the most commonly used medication is the stimulant medication, and there are two main types we use. One is methylphenidate and the other is the amphetamines. Then there is a non-stimulant type, which is the most commonly one used is selective noradrenaline reuptake inhibitors, known as the atomoxetine or Strattera. So these are the main pharmacological treatments.
How is it like psychologically managed?
Psychologically, according to the evidence based out there, the most commonly one used is the cognitive behavioral therapy. There's a lot of research, a lot of evidence to say that, yes, CBT does work for ADHD. However, ADHD is a very complex diagnosis, and there will be occasions when simple sessions of CBT is just not enough and they need more. So when people need more therapy, sometimes I've got patients who have psychotherapy, psychodynamic psychotherapy. They have, they simply call it talking therapy. So they need to see the counselor for more. And then we also do something called ADHD coaching. So ADHD coaching is not just like simple psychological treatment, but there is an added component of looking at the lifestyle, looking at the assessment of the, so there is usually occupational health assessment that takes place, looking at the different areas of life, the different domains. So with ADHD, it affects multiple domains. So when you see a child having behavioral problems at school and he's perfectly fine at home, then you can challenge the diagnosis. So it is a global condition. So basically the symptoms will be present in different settings. So in occupational health assessment, they look at how ADHD is affecting the different areas of the life, and they make recommendations and they make changes. So this is how, talking therapy, CBT, or even psychotherapy, it does help a lot.
Okay, so coming back to pharmacotherapy, what is the difference between the stimulant and non-stimulant medication types? Like, how are they different?
So with the stimulant medication, as I mentioned, the most commonly ones are the methylphenidate, amphetamine, and there is a non-stimulant. So atomoxetine is most commonly used. There is another medication called guanfacine. We rarely use that medication. We don't know how exactly it works. But the main way how stimulants work versus non-stimulant is that stimulant targets one of the main neurochemical of the brain called dopamine, whereas atomoxetine, it targets norepinephrine. Now, stimulants are fast acting. The patient will see an improvement, see some changes within the first few days, whereas non-stimulants, they take a bit longer to act. They take about 2 to 4 weeks to have an effect. Now, before we start stimulant, we usually tell the patient to check the blood pressure, pulse, and weight, because this medication can, for some people, increase the blood pressure, increase the pulse, reduce appetite, leading to weight loss. Now, these side effects are very minimal in non-stimulant, because non-stimulant don't have these side effects. So if somebody has heart problems, if somebody has physical health complications, high blood pressure, so we usually avoid stimulants. And stimulants are more effective generally. 70 to 80% of the cases they're effective, whereas non-stimulants are effective in 50% of the cases, according to the data.
Okay, so like you mentioned, there could be a lot of overlapping symptoms with other psychiatric disorders. So in that case, how are these other comorbid psychiatric disorders going to affect the treatment of ADHD in itself?
Yeah, this is a question which most of my patients ask. Like they say, I'm on antidepressants. Can I continue to take ADHD medication? Do I have to stop my antidepressant? And the answer is no. You don't have to stop any antidepressant, any anxiety tablets if you're on ADHD medication. So both can go hand in hand. So comorbid psychiatric disorders, if they are very significant, like if depression is severe, if anxiety is severe, they need to be addressed separately. They need to be treated separately from ADHD. So there could be coexisting comorbid condition alongside ADHD. So both of them need to be treated individually. However, most of my patients, when they have ADHD and they have low mood irritability, they do see an improvement in the mood, improvement in sleep, improvement in the anxiety levels simply just by taking ADHD medication. And with the comorbid psychiatric conditions, what it can happen is sometimes people, if they say there could be sometimes they could have addiction problems. So in those cases, it may delay the response. It may delay the treatment for ADHD medication, the response to the ADHD treatment. So we normally advise our patients to reduce alcohol intake, to stop taking cannabis or any other drugs.
Okay, so is there any correlation between ADHD and high functioning depression and anxiety states? Like, could there be an overlapping symptom or anything else?
So there is a lot of evidence to say that people with ADHD are more likely than others to develop depression and anxiety. So the incidence of depression and anxiety may be slightly higher among those patients who have ADHD. And the answer is very simple. It could be due to the stress in life, the challenging situations they face, and they're unable to cope with it. So that might explain. So the ADHD, although it is a very, it is a significant condition, but people can be very high functioning. I have seen patients who go on to do PhD, they do very high profile jobs, and they somehow cope with their ADHD symptoms. But they do it at a lot of huge thing in stakes. if they're doing well in their career, then their family life is affected. So their relationship is affected. So, there is a bit of an imbalance, work-life imbalance. So yes, there could be some high functioning anxiety states going on there.
Could you throw some more light on high functioning depression and anxiety states?
So high functioning depression, anxiety could be things like people are doing quite well in their lives. They could be having a high profile job. They could be, doing really well academically or in their employment. But their internal state, there is a lot of turmoil. And in fact, sometimes they cope by taking drugs. They cope by taking self-medicating. So, and then what happens is there is an underlying ADHD which is not detected, which goes undetected. So people who are high functioning usually mask their symptoms a lot. So that is the problem.
So what are the challenges that are faced in diagnosing ADHD in a fairly conservative society like India?
So, well, this is again my speculation. I could be wrong here. So I do apologize. I don't want to hurt anybody's sentiments or feelings here. This is purely my own views. I think stigma is present, not just in India, but throughout the world. We have a problem of stigma related to mental illness. Not just ADHD, for any mental illness. People hesitate to seek help. And that is the number one challenge. The second challenge is the lack of awareness in schools regarding this condition. So ADHD could be easily misdiagnosed as a bad behavior, laziness, and then there is a tendency to punish children, to penalize the children, and even health professionals. I mean, the awareness that ADHD can present even in adults. So this conception, this awareness is not there even among health professionals. So we need a bit more awareness, bit more education, and these kind of webinars, these kind of tutorials, this kind of educational activity is really very helpful. And parents don't know where to seek help. So even if a child has a problem, and sometimes there is also problem like dyslexia, dyspraxia, and so there could be other psychiatric comorbid conditions, and parents are simply, they feel helpless and they don't know where to seek help. So a bit of signposting, a bit of awareness in the community. So just basically in the grassroots level, it doesn't even have to be super specialist hospital. They could be just simple information available in the local surgery, in the local doctor's clinics, that if your child, or even in the schools, like they could give out some posters, some handouts on the school notice board to say, look, if your child has got ADHD symptoms, look out for these symptoms. And if you think your child is struggling with these symptoms, signpost them to areas you could seek help, or contact phone number, or even practitioners who are specialists in ADHD. So a bit more awareness is needed.
So you mentioned helplessness amongst parents. So what other attitudes do parents have usually when they get a diagnosis that their child has some learning disability or something like ADHD? So what is their usual attitude other than helplessness?
So I think once the child gets diagnosed and there is a lot of psychoeducation, things can get better. I think we need to look at the issues before the diagnosis. Before diagnosis, what happens? The child is there and the parent is there and they're struggling. And there could be a lot of impatience, pressurizing the children to perform beyond their limits. So that problem is there, a lack of understanding, lack of empathy. But then after getting the diagnosis, there might also be a problem of impatience, because then they feel that, or also helplessness. Are they going to be stuck with this condition for the rest of their lives? What to do? But the good thing is that ADHD is a very treatable condition. There is a marked difference. So the reason we need more awareness is because this condition is very easily treatable with medication. Even if psychology is not around, psychological treatment and medication is the gold standard. But if psychological treatment is not available, even with medication, there is a huge difference. So parents don't need to feel helpless. They don't need to have this. So they just need to get the children assessed, get diagnosed, and start treatment. And they will see a huge difference. Schools have a lot of pressure and expectations from children, and there is a lot of pressure on the parents from the school, like if homework is not done on time, so there is a huge pressure on the parents themselves. So they have to answer the teachers. So I think this whole cycle of impatience, the whole cycle of lack of understanding, it needs to be tackled. But I think the first thing is for the child to get an assessment, to get a diagnosis.
So how can parents, teachers in the school contribute more in management of ADHD? Other than spreading knowledge, other than the poster drives, like what can they do? How can the teachers help with the situation?
The first thing is to spot the symptoms. So looking at what are the common symptoms the child can have in school, things like mind wandering, daydreaming, then unable to understand complex verbal sentences or verbal instructions, being easily distracted, then requiring more time to complete a task, forgetfulness, difficulty to sustain attention, particularly when they're bored. So they could be easily bored, they're hyperactive, they're running around, they're talking, and difficulty in following explanation. And sometimes this child could even hyper focus on a topic they're very much interested in. So ADHD is not only about inattention. They do have an ability to hyper focus. So if somebody likes art or somebody likes music, they can spend hours and hours on that, to the extent that they forget to eat, they forget to even brush their teeth and things like that. So what can the school do? What can teachers do? So the answer is make reasonable adjustments. Number one is to get them diagnosed. Number one is to get the treatment. However, schools do have a responsibility to make reasonable adjustments, schools and colleges, like giving extra time, 25 to 50% extra time in exams, giving a separate room for writing the exams, having a flexible start time for examinations, and then giving multiple breaks, and ability to negotiate deadlines and extension, particularly in college and university, and having one-to-one coaching, a bit of mentoring support. And if there is a possibility to have some coaching, like academic coaching, and they may need a bit more time to understand the information, and they may need, like nowadays everybody is doing Zoom lessons, Zoom classes, and a child with ADHD will find it very difficult to sustain attention for long periods of time. So making some adjustment for them, I think it will help.
So what are the other social factors that are important in determining the outcome of ADHD?
So the social factors, mostly, I think I would look at social support network. So people who have a good support network for any mental illness, not just ADHD, they usually have a positive outcome. Reducing stress at work, reducing stress in relationships, and general stress levels, if they can reduce, that can really help. Having work-life balance, having a healthy lifestyle, reducing intake of alcohol, drugs, because these have a negative outcome. So all of these factors, they do play a big role. And I think having a supportive family member, having good social network, it's really, really very important.
So, ma'am, last question. Are there any myths or stigmas around ADHD that need to be busted?
Well, the only thing I can say is ADHD, number one, is that ADHD is not bad behavior. They're not deliberately trying to be naughty. So it's not that. So anybody who seemingly can look a bit, outside the box, like very disruptive, naughty, or, challenging authority, get them assessed. I'm trying to understand them. That's number one. Number two, ADHD is a chronic condition, but it's not untreatable. People do get better. People lead normal lives with ADHD. It is possible to lead a completely normal, highly fulfilling life with an ADHD. I've got so many colleagues who are doctors, who are engineers, scientists who have ADHD. In fact, having ADHD is a blessing in disguise, because people with ADHD, they have a lot of energy. They have a lot of inner energy and drive, and they just need to channel it properly, rather than getting distracted from one task to another. And ADHD people are incredibly positive. They don't dwell on negative thoughts. they are looking for solutions. They don't like, so anything that disturbs them mentally, they don't like it. They just want to move away from any negative influence. So they're incredibly positive people.
Okay. Ma'am, now if you wouldn't mind, we'll have some questions from our audience.
Okay.
Okay. You can just ask the questions one by one. I'll call out your names you can mention your names in the chat box, and you can do that, and it'll be great if you can turn on your cameras. So first question is by Ria Goel.
Hi. So my question was, is there a possibility that the child was good in academics and everything, but still can show other symptoms of ADHD while being very functional that way?
Yes, absolutely, 100%. I would say 70% of my patients that I see as adults, because I'm not a child psychiatrist, I'm an adult psychiatrist. So when I see my patients and I see they have done incredibly well in their school exams, and they say, yeah, because more than 70% of the ADHD, when they're children, they're incredibly bright, they're very talented, they're very intelligent. So what they say is, I do really well in exams, but what I can't deal with is just the routine, boring task of doing daily homework, doing this. So what they do, people with ADHD, they do very well with deadlines. So if there is a coming looming deadline or an exam scenario and there's a high pressure, the brain really functions very well. So there is a switch. So they do like remote cues. So because they know with exams, if they do well, they'll have a good marks and this and that. So when there is a reward out there, ADHD brain can function really, really well.
Next question is by Manas Anand.
Yeah, so ma'am, there has been a very common saying across people that the children who are diagnosed with ADHD are very hyperactive in nature, should avoid sugar consumption. So is there some medicinal basis to that, if any?
Yes, I know that they say they should avoid sugar, and people can vouch, like lots of parents can vouch that the day when the children eat less sugar or less sugary treats, they are less hyperactive. I think it is more to do with the hyperactiveness. I don't know if it does make any difference for the inattentiveness. But as I mentioned, having a healthy lifestyle is very important, because it's not just the sugar, it is also other food, other junk food, and also drinks. So aspartame, sweeteners like aspartame and things like that. So I think it's always a good idea to have a healthy eating habits.
Next question by Dr. Rituraj.
Hello, ma'am. I just wanted to ask, like, how to diagnose ADHD when it's present in the background of like genetic conditions like fragile X and or even fetal alcohol syndrome also.
So what we normally tell our patients is that just because somebody has genes of ADHD doesn't mean they will express them and they will develop it. So ADHD etiology is very, it's complex. So it's not just the genetic component, it's also the environmental and socio-environmental complex, and also the lifestyle, like pregnancy. They even look at things like, was she smoking and drinking during her pregnancy? So they do have some association with the exposure, things like that. So I don't know how to answer your question, because we don't do genetic tests for ADHD. We don't diagnose ADHD with a genetic test. We look at the global impairment. How has the symptoms affected work? Because not everybody who has genes will express the condition, if it makes sense.
But then it's actually gonna go undiagnosed, na?
No, it won't go undiagnosed if they have the symptoms. If they have the symptoms. So if you are saying that if they have the symptoms of fragile X and the symptoms of fetal alcohol, then will ADHD get diagnosed? Is that what you're saying?
Yes, sort of.
Well, it's very difficult to say that, because these conditions are slightly different from ADHD. And when we do ADHD, we do a very thorough assessment. So I don't think it will get undiagnosed. I think if ADHD is present, and if it is affecting their school, academic, and work life, then it definitely will get diagnosed. the only thing is they have to come for an assessment. The block is not getting diagnosed by the doctor. It's about seeking help. So if the parents are aware and they're doubting this diagnosis, they should seek help.
I hope that answers your question. Next, we have Manas Anand again.
Ma'am, so as you talked about CBT as a form of therapy that's majorly used, but on a very personal level, I've come across folks wherein CBT, even to treat anxiety and depression disorders, isn't really receptive. So what is a more wider approach in terms of the psychological treatment aspect to ADHD in adults mainly?
So I'm not very sure in India what is the situation, how the psychological treatments availability in terms of access to psychological treatment work. But here in the UK, CBT is very, very popular. Everybody knows we do refer for CBT for conditions like depression, anxiety, and because the research base is very good. Now in India, if CBT is not very receptive, then you could call it as a talking therapy. You don't have to even call it CBT, because CBT is a very technical term which is being offered by the psychologist. So I think as long as somebody is saying a therapist, you can call them a therapist, counseling, it doesn't matter, because any form of therapy is useful. Any form of therapy is, talking therapy is helpful. And in fact, people who don't want to go to a therapist, who don't want to have like pay lots of money for treatment, they can try lots of techniques. There's lots of apps out there, CBT apps are there, self-guided. There is a lot of self-guided CBT, but these are more for people who have milder symptoms and whose symptoms are controlled with medication, and they're just looking for some extra. They could help self-guided CBT. They could do self-guided mindfulness meditation exercises. All of these are really helpful.
Next question by Shaunak Bose.
Yeah, good afternoon, ma'am. My question is, can ADHD lead to a predisposition towards drug abuse? Because as you said, in pharmacological therapy, amphetamine is suggested, like Adderall. So would an ADHD patient tend to drug abuse?
Yes, they do. So they do. There are a couple of reasons why. Number one is they do have reward. They do respond to reward cue. They're looking for sensory stimulus, and the drugs provide them the instant high. And sometimes these drugs can also provide some kind of solution. So people do abuse drugs, particularly amphetamine-based drugs, and sometimes the reason they do use drugs is to manage the symptoms. So I've had few patients who said, I wasn't getting diagnosed, nobody was helping me, so I was resorting to self-managing my own problems with drugs. So they do have a predisposition to drug. And the other thing is, when we prescribe amphetamine, which has a potential for abuse, it has to be done. It's a controlled drug. We have to make sure that they are not misusing or abusing it.
Thank you, ma'am.
Next question is by Surjabha.
Hello, good afternoon. Thank you, ma'am, for the wonderful session. I just had a couple of questions. Ma'am, for ADHD, the medications, the medical management that is done, how long is it done for? Is it medication which is taken for a lifelong period, or is it for a limited duration?
That's a very good question, and I get asked these questions a lot. So most of the children, when they get started on ADHD medication, it's usually taken off by the time they reach the age of 18 years. Because normally 50% of the patients, they do get better, and the symptoms are not very, they don't stay. But unfortunately, for another 50% of the people, their symptoms do carry on into adulthood. Manifests as more of inner restlessness, anxiety problems, inability to focus, concentrate, all of that, and fidgeting, hyperactive symptoms as well. So when symptoms are persistent in adulthood, or if somebody does not get diagnosed as a child and they're struggling as a child, go on to adulthood and they're still struggling, and they do need medication, So it depends on their life circumstances. Like most of the patients who come to me as adults are at a stage where there is some stress in their life, like exam situation or a new job, or they're just new parent and they need some extra support. So when you have an extra stress in your life, it's good to have medication for ADHD. When you're in a very stable situation where you feel that you don't need the medication, you can come off and see how you're coping. But every time there is a stress, every time there is an added challenge in your life, it's a good idea to take the medication. But you can, it's not a medication that your body gets used to, and if you stop it, then you cannot start it again. But people do have periods, some gap periods, when they don't take the medication for a few years, and again when they have some challenges in their life, they can restart it. With children, I think the normal rule of thumb is they're taken off medication by the time they're 18. Most of them, they're weaned off.
Thank you, ma'am. Ma'am, one more question is, like, how different is the, the overall picture of ADHD, as in the diagnosis or the management in UK as compared to India? Is it any way different, or like, is there anything which is any symptom or any stress factor which is different in the two places?
Well, it wouldn't be fair on me to answer this question because I don't work in India. I don't know what common management strategies are adopted by doctors there in India. I think you would be better off asking a psychiatrist from India this question. Ideally somebody who has practiced both in the UK and in India to give you a very correct answer. I don't want to mislead you with this answer.
Okay, ma'am. Thank you. Thank you.
Next, we have a question from Manas.
Ma'am, carrying forward the previous question I asked, how effective would psychoanalysis and hypnosis be as therapeutic strategies to patients with ADHD?
Okay, so this question is a bit tough for me to answer because my background is psychiatry. So a psychologist expert can answer this question because these are different modalities of psychological treatment. From my experience is that any form of psychological treatment is effective, I would say, whether it is CBT, psychotherapy. I mean, hypnosis, I don't know, because hypnosis is a bit, it's not mainstream psychology. It's a bit outside the box. I can't comment on hypnosis. Some people claim, people who practice hypnosis, they do claim that it's very effective. I don't know, to be honest with you.
Okay.
Thank you, ma'am.
Next, we have a question from Riya Goyal.
Yes. So, ma'am, I wanted to ask, what is usually the assessment period? Like, how long does it take to diagnose someone with ADHD? And what if the person concerned doesn't, remember a lot of chunk of their childhood or how it has affected them? Will it hamper the diagnosis process or the assessment process?
So I can talk about both children and adults. So with children, what they do, this is, I used to work in a children's service long time ago. And with children's services, the psychiatrist will give out some questionnaires to the parents and questionnaires to the teachers. And then the teachers and the parents have to fill out the questionnaires, submit it to the psychiatrist. And then the psychiatrist gives an appointment with the patient, like the child, to come along with the parent. And then the assessment usually lasts between 1 to 2 hours, and the psychiatrist will observe the child, ask questions, and then look at all the questionnaires and then make a diagnosis. So it is a process. It depends on how long they take to fill out the questionnaires. The whole process, there is a process to that. With adults, the way we do is, like if somebody has an appointment with me, I usually give out the questionnaires in advance. I tell them, you've got an appointment with me, and usually it lasts for an hour. I give them the questionnaires, and they have to complete it, and an informant also have to complete. And once they complete and they submit, then I look at the questionnaires, I look at all the scores, and then I assess them. So the assessment period is 1 hour. Sometimes it can take longer, but we look at like a lot of information is already there in the questionnaires already. So we don't spend too much time repeating the information. So if there is any doubt in the diagnosis, obviously we can take more time, but usually there's a lot of information that we collect prior to the assessment. So although in theory it looks like it can take between an hour to 2 hours, but the process, there's a process to the diagnosis, which is collecting information. So that can take as long as, you know, like 1 month, however long they take to give you the information.
Okay, thank you so much, ma'am.
You're welcome.
Do you have any more questions? I suppose then that's it. Thank you so much, ma'am. It was a very insightful interview, and I'm sure all of us learned a lot today.